Hi everyone, this video is intended for our new surgical techs that have onboarded with us. We're just going to go over a little bit about sex and gender, since that is something we do deal with on a daily basis, and it is something that's very crucial to the hospital. So let's just dive right in. So sex is defined as, I'm going to read the definition for us. It is either of the two main categories, male or female, into which humans and most other living things are divided on the base of their reproductive organs. This means we're going solely off your organs. Vagina, penis, whichever one you have, is what you are defined as. Gender is defined as either one of the two sexes, especially when considered with reference to social and cultural differences rather than biological ones. So in this case, we're not so much focusing on the reproductive organs themselves, but rather the patient, social and culturally. This term is also used more broadly to denote a range of identities that do not correspond to established ideas of male and female. So kind of what I just said. So this is more based off of the patient. The patient, if they're feeling that they are more male than they are female, it's going to go to social and cultural differences that they are going to be responding to. Now, with those two things defined, it's important to remember that, yes, while we do have females that are female based on the reproductive systems, if they are coming in and they are a male, we still need to respect that. And we need to respect that their gender is not what their sex is. Because as we said, sex is defined as either one of the two, male or female, based off of the reproductive organs. So in that case, let's talk about some biological differences. So men usually built stronger. They're usually built bigger. They typically have deeper voices. They're physically more masculine than women, typically, in the face, in the structure of the bones, and how they're built. They're usually more accident prone. They're not so emotional. They tend to be go, go, go with their emotions and just kind of not get over it, but there's a little bit more emotionless, I would say. They tend also to be more dominant in situations. Women are usually smaller in stature. They're usually not as strong as men. Not saying that they can't get there, but typically we're smaller. Not as deep of voices. They tend to be more delicate. Kind of goes back to the whole accident prone thing. Women tend to have it a little bit more together. We tend to be more emotional, obviously. We're women. We typically can rationalize emotions better, and we typically can empathize better than men can, and that's actually been proven psychologically. We typically have maternal instincts, good old maternal instincts that we go off of, and they kick in. Those mama bear instincts that kick in, those would be those maternal instincts. We obviously have those more than men do, especially in the hospital settings. We typically are the ones that is crying at the bedside and being too emotionally involved with our patients. But there are some men, especially in the medical field, that are actually really good about this. And they're good about having those emotions and letting the patient feel and walking them through what that looks like, even if it may be a little bit hard for them. So typically, this is what we're going to talk about next, is kind of what I've seen in the OR and what we may see in the OR. And I think this is kind of also just the medical field in general. Men are usually taken more seriously in the medical field. It's just a known fact. Women are usually looked as the help. That is actually very true as well. Anytime you hear of a doctor or a surgeon or someone of higher authority, even if you don't know who they are, you are typically going to say he. Oh, is he the surgeon? Oh, is he the doctor? And it's just something psychologically that we have developed. And while there are more male doctors, women are still out there too. So like I said, women are usually looked at as the help, typically because we're smaller. We're not as dominant as men are. In some situations, women are tested more by patients. They are tested more physically, emotionally. Patients tend to get more violent with women, especially smaller women. When they're waking up from anesthesia, they have no idea what's going on. They have no idea where they are. All they know is they're coming off drugs. And so women tend to be at a higher risk of being someone's walking by. So women tend to be at a higher risk for being attacked in hospitals or being physically pushed or emotionally pushed by patients. This has actually been proven. I want to say it's like 30-something% of women tend to have more issues with their patients than males. And that's on any level. That's not just in the operating room. That is for everyone. Floor nurses, med-surg, that's for everyone. Then we also have the aspect of sometimes men can be too cold for female patients and women can be too sensitive for male patients, and that's going to affect how we interact with our patients and how their type of care and how they're going to respond to their surgery. There's also a respect factor for both genders that comes into play. Typically men respect men more and women respect women more. And so that can definitely be a struggle because, especially in the operating room, you're a team. You have men and women. So you'll have a male doctor, woman nurse, and you both have to be there for that patient. And that patient has to equally respect both of you. So there definitely is not a power struggle, but there definitely is more of a dominance in those aspects. And you definitely have to be confident, and both sides. You have to be confident, and you have to be, 100% of, we are here for you, and we're going to do everything it takes for you. Also, genders, one big thing in the operating room. Specific genders, so male or female, typically prefer the same gender to be in the room. This is very true for females, especially young females. They do not want males in the room. They typically want all female teams. And the same thing goes for men. Men usually want, not so much younger men, but men in general typically want men to be in the room. Sometimes they get uncomfortable with women, especially if it's someone who is like a scrub tech, who is helping the surgeon and who's right there at the front lines with him. It definitely makes a difference. I have experienced this personally. I have been in on multiple all-female rooms, no men allowed, and that's something that we take very highly. We cover the windows. We don't let men in the room. Not even if it's for a question. You can call into the room, but you are not coming into the room, even if the patient is asleep. It's just a respect thing. And the same thing goes for men. Men do the same exact thing. They don't let women in the room. You can call in if you have a question or concern. Same thing, cover the windows and everything. Gender and sex is something in the OR that we take very seriously. Because when you are in surgery, you are stripped of all of your clothing and you are exposed to everyone. So this is something that we want our patients to come in and feel comfortable and knowing that we respect their gender, or we respect their sex, or we respect the fact that they want an all-woman staff and it's a young girl, or if it's an elderly woman. It's totally up to them. It's whatever they want in the OR and whatever is going to make them feel better, because that's going to make their care better. It's going to make it easier for them mentally and emotionally to recover. And it's going to be better for everyone in the end, because then we'll be that support staff and we'll be that support for them. And that's what they need, especially when they're getting surgery. Surgery is a scary place. No matter how many times I walk into that room, I look at these patients and you still see fear. And it just makes me want to be there for them and do the best that I can for them. And this is where that starts.